Hi, I'm Andrea Leonard. I am a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. I wanted to take a couple minutes and talk to you as health and fitness professionals about how to help somebody recover from breast reconstruction with an abdominal TRAM. So a transrectus abdominis myocutaneous flap. It's a mouthful. And in this procedure, they actually go in and they do a cosmetic tummy tuck. So there is an incision from hip to hip, and they tunnel the rectus abdominis up through the mastectomy scar, bring it out, and it is still receiving the blood supply. So that helps to ensure that this flap will not die, will not become necrotic. And so if it's one side, they go diagonally, contralaterally, with one side of the rectus, or if it's bilateral, they'll take both sides of the rectus abdominis. So what a lot of people don't understand is that the rectus abdominis still responds as it did when it was in the stomach. The brain doesn't know that it is now in the breast. So let's say they had a unilateral, just one side, and you as the fitness professional said, well, let's strengthen the other side, let's do crunches. What would actually happen is one breast would contract and one side of the abdomen would contract. So while we want to do core exercises, that is so important, doing crunches is not recommended. If it's bilateral, they won't even be able to do it. But if it's unilateral, they can, but you have to ask yourself, why? Why would you have them do those exercises? So let's go back a little bit. In the weeks following an abdominal TRAM procedure, the patient will probably be flexed forward at the hips. It can be from fear, from pain, whatever the reason is. And so their body may get used to that poor posture. So when we first meet the client and do a postural assessment, we need to see, are they flexed forward? Are they standing erect? Or what happens months later is they become hyperlordotic. So they get an excessive curvature in their lower back because the abdomen becomes weak from the lack of the rectus abdominis muscles, and the lower back muscles overcompensate. So they become dominant and can cause that, what we call sway back. So in that particular case, we want to do core exercises. We want to do lower back strengthening, but a ton of lower back stretching, and work all of the other muscles besides the rectus abdominis, transverse abdominis, the obliques, external, internal, multifidus, you name it, all the spinal stabilizers. Think about exercises on the BOSU, the foam roller, balance discs, but don't start your 65-year-old client on a BOSU. Work on balance standing on the floor, then progress to something like balance discs or just a foam pad, and then gradually you can work up to an even more unstable surface. But core work is going to be critical. In addition, on top of the mastectomy scar, adhesion, scar tissue, now it's compounded by this reconstructive procedure. So we're going to see an exacerbated round shoulder syndrome, upper cross syndrome. You're going to need to stretch the chest musculature while strengthening posteriorly all of the upper back muscles. But before doing any strength training, you're going to assess range of motion using a goniometer. And expect that most planes of shoulder range of motion will be impaired from the procedure, and then more so if they've had radiation as well. Also, if they've had radiation or lymph nodes removed in the process, they'll be at risk for lymphedema in the chest or lat area, and then that affected side. So there is a lot to consider here, and I implore you to learn more through our extensive cancer exercise specialist training, so that you can work safely, effectively, and most of all, confidently with breast cancer patients and survivors, and specifically talking about rectus abdominis reconstruction right now in a lat flap. So fortunately, we are now offering live classes throughout Asia, and we also have our online training available. So please visit us at ceti.teachable.com to learn more about our courses.